Bismillahirrahmanirrahim. This patient, 70-year-old, presents with swelling in the umbilical area with severe pain since one day. Let's see what I will find in ultrasound. Now I am sliding from epigastrium to the umbilicals. Here we see skin, subcutaneous fat layers, muscles, and peritoneal cavity. We see there is a defect between two echogenic lines, and here is hypoechoic area. This is a rupture of anterior abdominal wall layer or peritoneal layer. Small intestine in the anterior abdominal wall. Here again there is continuous line. Now I will focus. These are gut containing food contents, but there is no peristalsis. I will focus at this point. There is no peristalsis and no food content movement. Now I am focusing at this point and observe peristalsis, but there is no peristalsis. No movement of food contents. It means the guts are obstructed here with absent peristalsis. I am rotating the probe to the oblique side to see some to want to check peristalsis, but cannot found any peristalsis. Sometimes there is feelings like there is some movement of food contents, but cannot be ruled out. Now I will start measuring the size of defect from one end of ruptured wall to the second end. This is basically a defect in the anterior abdominal wall muscles. Which is 17.6 millimeter. This is how we will measure the defect of anterior abdominal wall. And there is a part of intestine also obstructed here, which separate the ends, bilateral ends of the anterior abdominal wall muscles. Now how we will write report. A filling defect or rental defect size 17 mm present in the anterior abdominal wall containing gut loops. Peristalsis is absent. My ultrasound diagnosis obstructed paraumbilical hernia.